in the suburbs of Mumbai. And today I'm live to attend the questions on hair loss treatment and hair transplant related questions. As you know that my own hair transplant journey is live. There are 9 episodes in which I have tried to cover everything into that series. Meanwhile, I'm getting some queries. So this was a live session which I have planned with my team to address to the queries related to hair transplant and hair loss. We will wait for some more participants to join us because we are expecting some more guests to join us, and then we'll try to address the questions. Uh, Meanwhile, if I would like to put your comments or questions in the comment box so we can start addressing those questions. So that is my, till the time we are getting some questions, I can start showing you my result. That is my result of hair transplant. I have undergone my hair transplant, on which the series is there on the YouTube platforms. And issues which I have felt in the hair transplant is one that I had an allergic reaction during my hair transplant, even after taking the test dose, which was picked up earlier. That is one thing. I had some delayed in the kind of sensation gain into my transplanted area. It was numb for at least 3 months. But now I gain it completely. I had seen some hair fall again of my transplanted head, but the roots were not there into the fallen strands. So I am hopeful if that's a kind of a normal natural process of hair falling. I had some boils and small follicles on my donor area, but they were all kind of settled down within 5 to 7 days, the due course of time, without any antibiotic or without anything. By saying that, even when my growth was appearing during my 4th to 5th month of transplant, I had some follicle, some small boils appearing onto my transplanted area. Again, once the stem was out or the follicle was out, it settled down completely. So that was the whole idea about my own hair transplant. And we have one question asking about the conservative treatment of hair transplant, which I have not mentioned, or kind of a hair loss rather, which I would like to take this question. Even in my first slide, I had mentioned that I would like to discuss about the hair loss in detail. So in my clinic, what I talk to my patient is that we always attend the hair loss with the 5 treatment modalities. One is a lifestyle change, second is a medical therapy, third is a non-invasive or a minimal invasive therapy, then comes the invasive or transplantation, and fifth is a camouflage. Not every patient is a candidate for hair transplant. At the same time, not every patient is a candidate for the conservative therapy. So we have to customize, or we at least in the head and shape clinic, we customize the treatment as per what is the patient's expectation, what is the end point. By end point, what I mean is there are some patients, they want the best possible result in 6 months or 7 months due to their other commitments. In them, my plan changes. At the same time, there are certain patients, they come to us that we just want a basic therapy to maintain the hair, decrease the hair loss. For them, the plan changes. So it is not kind of a mathematical rule or thumb rule. It has to be customized as per the patient's requirement. In a conservative treatment or a conservative umbrella, what we normally see is lifestyle change is equally important. By lifestyle change, what I mean is at least 30 minutes of exercise in the form of walk, jog, or weights or yoga. Anything spending 30 minutes with yourself, relaxing yourself, de-stressing yourself is equally important than any other medical treatment. So that's 30 minutes of exercise, 6 to 8 hours of sleep, 2 to 3 liters of water, that varies as per the patient's weight, and the nutritional importance, high protein, low calorie diet, Vitamins correction if there are any. Nicotine, strict nicotine. Stopping the use of nicotine in any form. That could be chewing, that could be smoking, that could be hookah. In any form, it should be stopped. Apart from that, now the lifestyle change is equally important, or I would say it's one of the treating modalities when my patient is in the age group of 16 to 17 years, in which mainly by changing the lifestyle without any medication, we can at least stop the hair fall or halt the hair fall. Now, all these treatment are basically speed breakers into the hair fall journey. People do ask me about the guarantee. People do ask me about what is the expected outcome, and I always say them that all these modalities are at least a speed breaker into your progression of hair fall. So when only 10 to 15% of the hair loss has been seen by the patient, and they approach to a hair transplant surgeon by only vitamin supplementations, any micronutrient supplementation in a lifestyle modalities, we can reverse or at least halt the balding process. When more than 15% hairs are losing up and the scalp is more visible, I cannot depend only on lifestyle modification. So I have to introduce my medical treatment along with either PRP or other invasive or a minimally invasive procedures. And that's how it goes. Even after doing PRP, the success rate of PRP in my clinic is around 60 to 70%, in which if I'm doing PRP, not all my patients they get results with PRP, because PRP itself has some limitation. It itself has some success ratio. By saying this, what we normally see is people come or patients come to us, they are taking medications, so they have started taking the medications but stopped at the second month or third month because they were not seeing any results. Now, medical treatment, you will never see results between 2 to 3 months. Mostly, if you see, you are lucky one. But most of them, they are a long treatment in which requires at least 6 to 7 months along with the lifestyle modification. I'll give you one example. If I'm a smoker and I'm not going to quit my smoking, that is going to harm my hair. And then even if I keep on taking my medicines, even for 7-8 months, it will have some guarded response as compared to the one who is non-smoking. So that is the importance of lifestyle. Or if I have my night schedules, or if I have my stressful job, and I'm trying to salvage my hair, even it will have some limitations. So the whole point in saying all this is it's a holistic approach in which the patient's involvement is equally important than or equally important as a hair transplant surgeon's involvement. There are a few questions lined up. I would like to see them right now. I mean, my technical team is outside. Just a second. Yeah. Pinkish, can you attend the questions first? There are some questions. This side. So change it, no? Tendency and attend the questions. We'll take a 2 minutes break. The technical team is doing some corrections into the landscaping board, and meanwhile, I'll start seeing the questions. Give it to my hand. So Pratik is asking me, I have done PRP 45 days back. Is it okay to take COVID vaccine? Pratik, I think it is okay to take COVID vaccines. Till now, we have not received any documentation or literature on the contradiction of not taking vaccine. In this pandemic scenario, vaccine is more important than your hair and the PRP. So please go forward and take your vaccine. Manoj, yes, we did that. We did that. Yeah, we changed the orientation. Yeah, thank you, Sunny. Pratik, you can start your PRP again after taking the vaccine once you are normal. I think 5 to 7 days should be enough to start your PRP again. Okay, Pratik, take care. Stay healthy. So Rishikesh is asking me, sir, how many PRP session is required or need to be required after hair transplant? So Rishikesh, I think I'll take this question that minimum 4 are required. Now, let me make you understand that what is PRP? PRP is just the growth factors in your blood. Uh, Suppose your hair are not responding to PRP, there is no scientific reason why you should take or keep on taking the PRP. So if you are getting some good results, you should take at least minimum 4 PRPs, because till that time the hair follicles, transplanted hair follicles have not come out. So you are giving the nutrition to those follicles. After stopping the PRPs, 4 PRPs, you see how you are progressing. Most of the people, because of this 6 months of transplantation, they have changed their lifestyle pattern, they have taken some medicines. They don't require much of the invasive or non-invasive treatment. They are just happy with their lifestyle and the kind of a minimum vitamin supplementation. If you see the hair loss again, then we may have to introduce PRP again. Otherwise, 4 is enough post hair transplant. Let me take my questions line by line. Yeah. The Karan is asking me, sir, I have consulted dermatologist in Surat branch. They told me your donor is very poor with thin hair. Karan, it may happen. They told me, accept your condition, there is no chance for the hair transplant. I am depressed now. Karan, I would say there is no point in getting depressed. If the donor area is not healthy, they are just not healthy. You can't do anything about it. In a hair transplant, I can only take hair from your scalp. That depends on the grade of baldness. Then comes the beard, then comes the chest. That's the only donor area. If the grade of baldness is 7 and my donor area is very poor with a thin hair, by doing a hair transplant or attempting a hair transplant will rather give you a very unnatural look. So it's good in the Surat branch, they have attended very well, and they have kind of refused the hair transplant because we believe in delivering good results or aesthetic results than just going behind the numbers of surgeries we are doing. So if the donor area is very poor with a thin hair, please do not undergo a hair transplant thing. Go for a camouflage, go for a patch or a wig. Vijay Jaiswal is asking me, secure hair transplant Pune ka clinic अच्छा है sir. I have no idea, Vijay. Wherever you get comfortable with your doctor, you can carry forward with your hair transplant or hair treatment. What is the Manoj is asking me, what is the life of a planted hair? Manoj, the transplanted hair are the natural hair which we take from the back side to the front. If there are no stress factor in your life, if your your reasons for hair loss is been attempted well or are taken care well, then it can stay with you lifelong. But if the genetic factors are there which says that your hair should fall within 45 to 50 years, that cannot be changed by any hair transplant surgeon or by anyone. So again, by putting a transplanted hair or doing a hair transplant, we can bring back your age to 10 to 15 years back. But from that day onwards, again you are aging. This is not a static body in which we are implanting the hairs. Your body is dynamic. So everything is going to grow again. I have seen some patients treated by my seniors or other hair transplant surgeons, senior hair transplant surgeons in this country. They're coming to us at the age after 10 to 15 years of hair transplant just to increase some density with superbly maintained results. At the same time, we have seen some patients, they're coming back to us for the refilling even after second or three years of hair transplant. So it's very much individual. It is very much how we are taking care of your transplanted hair. I give this example to all my patients that if I undergo liver transplant and if I do not stop drinking alcohol as per my transplant surgeon's advice, my even transplanted liver is going to go into the harm. Even I may undergo liver failure again. So it is that important. Or even if I have a bypass surgery, and if I do not control my lifestyle, I'm going to have my cardiac issues again. So lifestyle is equally important. Thank you, Manoj. Sorry, Manoj. Someone is telling me the आवाज नहीं आ रहा है आपका. My technical team is at it. देखिएगा. क्या है? विजय, मैं समझ सकता हूँ अगर आपको इंग्लिश समझ में थोड़ा दिक्कत हो रही है. आप पर्सनल चैट पे या तो क्लिनिक के नंबर पर मैसेज कर सकते हैं. द टीम विल अटेंड टू योर क्वेरीज. Am I audible? Yeah, super. Vijay, kindly check from your side. There could be some problem at your end as well. So meanwhile, till the time I'm having another questions, I'll take this question or I'll take the opportunity to discuss about the PRP or a platelet-rich plasma. So in which it's a platelet-rich plasma. So your blood, some blood cells and a fluid. Take that blood and centrifuge it at a particular rotation per minute, because by the principles of normal physics, the heavier particle which are mainly the cells, they settle down in the test tube, settle down, and the clear which has iron, so they are heavier. At the junction of this RBCs and a plasma, there is a fine buffy coat layer or a pinkish layer which is platelet. Now platelets are there in the body for the normal coagulation process, or they have multiple growth factors and enzymes which are helpful to maintain the environment in the body. We take that platelet along with the uske बाजू का plasma, which makes it a platelet rich plasma. The upper portion of the plasma is a platelet poor plasma, PPP. So that becomes a platelet rich plasma. When we take this, we add some activators by which the platelet ruptures and all the growth factors are being dispersed in the solution. And those growth factors are important for the repairing mechanism or some stimulation required. When we inject this PRP in the scalp, they promote some microvasculature. There is the blood supply there, so more nutrients can go to the hair follicle, and then it can lead to more growth or a regeneration. This PRP, I call it as a jadi booty. This jadi booty we can put into the face for the face regeneration or rejuvenation. The same PRP goes in the sports injury patients, and some orthopedic surgeons they put this PRP for cartilage repair into the elbow or a knee joint. A same PRP can be used for the wounds or ulcers which are not healing and which are chronically sitting on the body. Can be used in infertility patients and can be used in the ulcers for the stomach ulcers or acidic ulcers. So it has been used widely in the by the medical fraternity. So it is the same PRP which goes into the scalp for some repairing work with a success rate of 60 to 70%, considering many factors. I myself was a PRP patient. I was taking some PRP, and by which I put a kind of a pause on my hair fall, and then I had my hair transplant. But there are some patients which may not get the result of PRP. Deep is asking me, sir, wanted to transplant but have issues of monoxide. Deep, what is monoxide? I am not able to understand what is monoxide. Do you want minoxidil? Do you want to ask me about the minoxidil? Then it's a different story. Please kindly reframe your question. Mohit has joined, sir, with the two folded hand. Mohit, thank you very much for this comment. I'm a huge fan of yours, and as you all likely know, Mohit is a very dear friend of this clinic. Manoj, no, we do not have clinic in Thane, but we are starting a collaboration with one of the clinic in Thane. Mohit is asking me success mantra क्या है आपके successful hair transplant के पीछे? I would say I waited for my hair transplant. I would say I waited for the right time for my hair transplant. I wasn't in hurry. As Mohit, you rightly know that everyone was asking me why you are not undergoing your hair transplant. There was different comment, negative comment whenever I was online about asking about my hair transplant. So I always tell my patient, you select the time of your life where you want to undergo this hair transplant. Do not just jump into the hair transplant. If I do not control my lifestyle, if I do not control my vitamins, if I do not have any control on my stress, I may not see the proper results of my hair transplant. And along with that, of course, to select a good clinic, good hair transplant surgeon, the experienced hair transplant surgeon, and the post-op care, washing, and medicines, of course. I have taken some supplementation for the proteins and for vitamins, and that really helped me out. So Deep, I think you have written a question again, or kind of did some addition to your question, which was you wanted to do hair transplant but have some issues of minoxidil. So what is minoxidil? Basically, it increases the blood supply again at the hair follicle level or the root level. Minoxidil is coming in by the multiple brands, by multiple carriers. Most of them have alcohol as a carrier of minoxidil going into your scalp. That alcohol is sometimes very itchy to the scalp or irritant to the scalp. Change the brand. If you're not okay with one of the brand you are using for minoxidil, change the brand or go for non-alcohol or alcohol-free minoxidil. Mini Check is, I think, one of the brand which is alcohol-free. If you are comfortable with that brand, then please continue that brand. Again, minoxidil is a pause button. People ask me that once I'm going to stop minoxidil, I'm going to see the hair loss again. So that is how it is. If I'm wearing a glass, that doesn't mean that I am dependent on glass. My eyesight is weak. That's why I'm wearing a glasses. At the same time, if your hair follicles are weak, you require minoxidil. If you're going to stop the minoxidil, you're going to see the hair fall again. That doesn't mean your hairs are dependent on minoxidil. But minoxidil is tried and tested all over the world. All the hair transplant surgeons, they believe in minoxidil. They have some successful outcome of minoxidil. So that's why it's a very important pharmaceutical drug, I would say, in your hair loss treatment. Coming to your question, that even after hair transplant, if you do not want to use minoxidil, still you are going to see some result of hair transplant. Post hair transplant, minoxidil, your biotin, your finasteride, PRP, these are additional factors to take out the maximum output of your hair transplant. That doesn't mean that if you do not apply these things, or you do not take PRP or medical treatment, you are not going to see any results of hair transplant. Transplant is going to come. The results of transplant is going to come. It may be guarded or less than expected, but it can come. So if you are too strong about not want to use minoxidil, still you can undergo hair transplant. Current reproductive age, kindly consult your doctor and
Wizard of is asking me. I'm sorry, I could not read the whole name. So yeah, I have level 6 baldness. Have consulted with Dr. Kanan in the clinic. I'm using remdesivir while I go for surgery. My question is: hair transplant permanent? If I'm indeed deficient, should I cure it? Obviously, you are supposed to cure a vitamin D deficient. Now, just correlate hair transplant with a plantation. If there is a kind of a small plot where I want to do plantation, if the soil is not good, if I'm supposed to do some basic work before doing my plantation, I have to do that. I cannot do plantation. I cannot do plantation in a compromised condition, or maybe then I may not see the proper results. So that's the whole idea. Vitamin, serum ferritin is iron content, and vitamin D and vitamin B12 equally important. Mohit is asking me, sir, transplanted and non-transplanted hair को लंबे टाइम तक कैसे बचा कर रखे? Again, going back to my 5 solutions to your hair is lifestyle modification, medical therapy, non-invasive therapy, that could be laser light therapy, that could be PRP, that could be other invasive or mesotherapy. Some of the people saw some results with hijama I think last year, last year. They were happy with hijama, but nowadays I'm not hearing about it. But again, if that helps you out, then there's nothing like it. So these are the modalities by which you can maintain your hair. And again, if lifestyle, I would again coming to that thing, people may get understanding. I'm putting so much stress on lifestyle because it is equally important. You have to maintain your lifestyle. Karan, yeah, we tried to solve that issue. The microphone had some problems because of, I think, yeah. I hope I'm audible now.
am I audible now? Better? Leaky has asked me Phoenix 1 milligram after hair transplant. How many months to use that Phoenix 1 milligram medicine? I would say 6 months. But if you are having some problems in between, you can go on an alternate day basis at the same time. So it is very much individual. You can customize as per your hair transplant surgeon. But if you are not in a reproductive age, if you are not seeing any side effect of Phoenix 1 milligram, you can continue that for 6 months. Yeah. Yeah. So Deep, if you're not having a good experience after using the minoxidil, please stop it. I mean, it may happen that your scalp is not just a recipient or kind of having a good effect for minoxidil, or kind of having a specific I would say, reaction to minoxidil, then you can just avoid using minoxidil. All the drugs, every patient or a person will have some or other kind of reaction. Likewise, if I have good results with some medicines, my brother may have the same allergic reaction with the same medicine. So if the minoxidil is the problem, stop using minoxidil. That is what else you can do for that. I mean, we try to customize our treatment as per the patient. If your scalp is showing some allergic reactions or a itchy or a boil with minoxidil, we try to bank upon more on PRP, more on finasteride, more on biotin than minoxidil then. So we have to customize it. So yeah, sure, Wizard. So Wizard, you asked me. Yeah, so vitamin D deficient is equally important to correct the vitamin D deficient and vitamin B12 deficiencies and the serum ferritin deficiency. Serum ferritin is basically your iron content. If I want to do any farming in the land, I will make sure that the soil is fertile. Just consider it that vitamin D, B12, and serum ferritin is going to make your scalp more recipient or uh, more fertile for your implanted hair. So yeah, you have to rectify or you have to kind of cure the deficiencies before hair transplant. That will give you. Minoxidil makes the hair very dry and rough. Yes, because the carrier of the minoxidil, which when it gets absorbed into the scalp, the drug precipitates on the hair. That means it's like a sea water and salt. When the water evaporates, the salt precipitates on the ground. Similarly, when we apply a minoxidil with any carrier, the minoxidil gets adherent to the head, and that makes it look very rough. For the per graph price, please contact clinic. Sir, mini check minoxidil good or not better than Tugain? Again, mini check, Tugain, we cannot say which is better, which is not better. Every brand are delivering good results. We are seeing results with every brand. Whatever suits your scalp, you can apply that. Vishal, you are asking me, can leg hair be placed on a donor side to make it look fuller? As a hair transplant surgeon, we can do anything. I mean, if you can ask me to put any hair anywhere, we can do that. But does that serve any purpose? What is the risk and what is the benefit of it? That is the question. We have not seen any issues till now with the donor area problem or the patients asking us to make it look more fuller. So the moment I think we'll advance in all this technique, we may start doing it, but I see very thin possibility of people coming to us and asking for this kind of surgeries. I think it should not be done. Karan, I don't know what tablet is that, androanagen tablet. You may share the content with us and we can guide you accordingly. But if I remember, you told me that the doctor told you that you are not a candidate for hair transplant. Then only on a conservative treatment with all these tablets, I'm not sure how much growth you're going to see on your scalp. That's no. You have that kind of expectation that in a grade 7 baldness, only a tablet will give you some output and is going to give the hair on the full scalp. Wizard, I need to see your scalp for that to answer that question. What to do with the global alopecia? Nothing. Go for a camouflage treatment. Wakar Siddiqui, I'm sorry, I'm not here to answer all these questions of yours. If you have any negative thing to discuss, please leave this forum. He's asking me, you don't want to clear our doubt, then you don't need to online. Hubby, if you need to understand about the hair transplant, kindly see my series of I have 9 episodes on hair transplant in which I have tried to cover my journey of hair transplant. We are going to put some more videos of PRP and some more videos of the progression of the hair transplant. But we have covered 1 month of the consulting to the hair transplant journey, which should solve all your questions. Lake is asking me, can you suggest replace folly hair tablets? Tell me another tablets. There are many. There are folly hair advance, folly boost. There are hair fix advance. Many. Each brand will have something extra or something additional to as compared to other brands, because that's how the company wants to sell their products, and every product they are coming with, they are kind of, I would say, more or less same into the result giving. So the biotin should be at least minimum 10 milligram. It's good. Deep hair and effect tablets are good. Wakar, contact clinic again. I'm not going to entertain the costing or the commercial factors of it. Kindly understand this is an educational forum. I'm here to answer the questions regarding medical treatment. Okay. No, Rishikesh, the hair transplant surgery is not performed by me on each and every patient. I have a team of doctors, and now it's a brand, and there are many doctors with me. My co-founder is also a hair transplant surgeon, and he does equally good job. Aradhya is asking me, for patients with the poor donor area, do you recommend it?
Aradhya? Yeah. The frontal, parietal, and temporal are the parts of the scalp. So, if there's a poor donor area, we suffice the area with the body hair. Yes, we take second donor is beard, and the third donor is chest. In the frontal is always the scalp hair. I cannot put in at least in my clinic we do not put beard hair for the front. So the frontal is always scalp hair. The temporal, I would again say, is scalp hair. Just behind,
Going behind, to which the requirement of other areas can be used for the backside. Chat box is not opening up. Just a second. Yep, we are ready. The next time we'll take care of the problems which we face in this live video for sure. Mahesh, PRP is not always compulsory after hair transplant. We have seen some patients coming to us from different country, or those who are sailor. They do not take PRP. Still, they are showing some very good results of hair transplant. So PRP, even if you cannot take it because of lockdown, which you have put on the message, it's okay. That's okay. So I think I have attended all your questions, and meanwhile, if you have any other questions, I am going to be live again, which will be kind of broadcasted by my team. Then when I will be live, and till that time, if you have any queries, you can drop messages to us on our social media pages. We'll try to solve them. I'm just going through the other messages, and I think I have tried, or I think I have answered every each and every questions. So by I think it's 2:46. By 2:55, I'll sign off. Meanwhile, I'll just wait for more questions. Na. Again, you have asked me the same question. No, it is not a wrong question. I do gynecomastia surgery, but this is the kind of forum in which I'm attending the hair transplant related questions. So, if at all you want to understand about the gynecomastia, put your contact number and details to our page on Facebook or Instagram or YouTube. We'll get back to you. Leaky derma roller is useful. You can use derma roller when you're applying minoxidil. Lovers, I am in Dubai after open flight. I am planning anytime. We are here to help you out as far as the hair problems are going, and of course, other plastic surgery problems are going. Mahesh, you have asked me that nowadays you are using Folly hair tablets. That is good for hair. Yeah, it is good for hair. Karan, you have written the androanagen tablet contains taurine, beta, pumpkin seeds, green tea. These are good for hair. You can take this. Yeah. Deep, you are asking me, sir, after PRO, is it compulsory? I think like PRP, yeah, PRP, is it compulsory use? No, yeah, you can. No, it's not compulsory. No, no. Rishikesh, we are trying. We may come up, but again, with this pandemic, even we are being affected. So once we streamline it, we may have some clinic in Central Line. We are not sure about it right now. Hubby, I have implanted 3,000 grafts on my scalp. You can see all my episodes of my transplant journey, so you'll have an idea. Vineet, I would say, I won't say there are other medical contraindication of undergoing hair transplant, but on a ethical ground, not again on an ethical ground. I mean, you have to see about how you can travel, how you can, where is the clinic, hair transplant. If it's nearby, you can go take all the safety precautions and undergo hair transplant. There's nothing wrong in it. But maintain all the safety precautions, see all the safety precautions in that clinic because COVID is more dangerous. And if I think in this surge, it's better to be more safe and healthy, and that should be the important, or that should be kind of priority, I would say. Again, lovers are asking me the same question: which one is better, hair effect or hair folly hair? It is very much subjective. It is like asking me a question that which car is better. What you get out of that tablet, it is subjective. Okay, if for me, if I have acidity problem, one brand may suits me, or one brand may not suit me. So please do not ask me question which is better. As I mentioned again and again, every brand has some positive and negative. If that suits you, go with that. Noor, yes, you can use all your beard hair to your for your scalp, but that is not again advisable. As an aesthetic surgeon or a plastic surgeon, we try to give a result with a minimum donor area deficit. So it's always go for the donor area which is hidden. Even when we take a beard, we take from a triangle which is not visible under the frontal view. So that's the whole idea. So we can do, but we don't do it. Wizard, I answered that question already. The hair transplant is permanent if you take care of your hair. If again understand your body is a dynamic body. If we are doing a hair transplant at the age of 25, your body is not going to be 25 all throughout. You are going to age, and hair loss is one of the aging process. I don't want to waste my beard hair in laser. Sorry, no, I don't. I can't understand that thing. Sorry. Okay, wizard. Yep. Hi Aradhya. Hi Dr. Aradhya Arya. I'm not very much active on LinkedIn right now, but you can get back to me maybe on my Facebook profile. Yeah. And I hope in London the things are settling down as per the pandemic surge. Lovebirds, you're asking me first time maximum कितना ग्राफ मिलेगा मेरा अच्छा donor area है my grades 4. Again we need to see you clinically to comment upon that. Shyam Sharma, after stopping minoxidil and folly hair, I got pimples on my face. Is it a side effect? Kindly see your doctor. Kindly see a hair transplant or a dermatologist. Of course, a hair transplant surgeon, which could be a dermatologist or a plastic surgeon. Kindly go and meet them or anyone. Tell me about other surgeons in the hair and shape surgery. Lakey, why are you asking me such questions? Kindly see our website, go to our page. There are many surgeries which we do. You want to understand the finances of the surgeries, get in touch with the team. They will explain you everything. Thank you, Lakey, to understand. Thank you. Okay, guys, it was nice to come online and have a chat with you directly. And I wish that we have such kind of sessions again and again. Till then, take care of yourself. It's a very difficult time which we all are facing. And be safe, be healthy. And meanwhile, if you want to attend any question, if your questions need any attention by us, drop us a message on Insta, Facebook, or YouTube. Bye. Take care, guys. Or even on mobile numbers which you already have. Bye. Take care. Bye.